everyone. I'm Helena Lee, and this is my colleague, Mr. J. Self.
Hello.
And we have got a very interesting list of questions from our patients and friends from Nystagmus Network to go through today. So, Jay, one of the first questions that we got is related to COVID, which I don't think anyone could have missed over the past 18 months. And that is, what can they tell about eyes from a video appointment? I guess the context of that is that more appointments have been switched to kind of virtual video or telephone consultation. So what information can we get from a video consultation?
Yeah, that's a good question, isn't it? So I think in reality, the video consultations that we've done have tended to be on people where we don't need to look at the details of the eye movements. So in reality, if it's a new patient with an unknown form of nystagmus and we need to see which way it's beating and what it's doing when you cover one eye, all that sort of stuff, that is just not suitable for a video appointment in reality. But we do have lots of patients where we've done all that and we're seeing them regularly for other reasons, so for more simple things or if they've got squints or whatever. So it tends to be those patients we've seen over video appointments. I guess it's going to vary up and down the country, isn't it? Probably, and probably vary according to whether it's kids or adults. And so as I see kids on the whole, I haven't had an appointment where I've never seen the baby and mum and dad have had to hold them in front of the video on the computer, thank goodness, because frankly, it just wouldn't work, would it? It tends to be for the ones that we've seen a few times. What about you?
Yeah, I think the only context where that might work is where one of our colleagues in another hospital will have assessed a new patient with nystagmus and then send a video on seeking advice. True. That can sometimes work where we can pick out something that's a bit more suspicious that isn't typical of nystagmus or suggests other investigations, but it's very limited when that does happen.
Yeah, no, that's really true. So we've seen lots of those. That's a good point. I didn't think about that. We have lots of people send us videos. We also have parents bring us videos that they've taken at home, which can be really, really useful, especially for something which is not there all the time or worse at certain times of the day. So yeah, no, that's a good point, isn't it? I think people can video things and it can be really helpful for us. But the chances of it happening during a Zoom call, a planned Zoom call, is pretty slim, isn't it? Yeah. I think on the whole.
It will never happen when you're trying to get it to happen.
No, so yeah, I suppose the summary answer is that for video consultations for people with nystagmus, it tends to be when you're doing stuff that doesn't involve you needing to know the absolute fine detail of that eye movement at that moment. And so it's advice stuff, it's about support, it's about all the other stuff, the holistic stuff that we try and do around it. Yeah, that'd be my answer.
Yeah.
Good. Okay, so next question we've got for you then, Helena, is when will the face-to-face appointment schedule be back on track?
Yeah, I wish I knew. I'd love to know when appointments will go back to normal. You could imagine we've had 18 months of delays, so you could at least expect another 18 months of delays while we're trying to catch up on people that were delayed from last year, but still trying to see the new really, really urgent cases. So I'm afraid if you're someone that we've already seen and treated, and we're fairly sure that you understand the condition and know how to manage it yourself, you're unfortunately going to be one of the ones that will be delayed because you're actually safe to be delayed. Do you agree, Jay? That's what I'm doing, and I hear that's what's happening elsewhere in the country. Anyone who's established and basically stable and safe, they're going to get postponed to get the newer, more acute patients in.
Yeah, totally. Yeah, no, I completely agree. And it's one of those funny things, isn't it, where if you're more well known to a clinic, generally people are more relaxed and probably trust people to spot things themselves, that kind of things, and then you get pushed back. The one thing I would say to people is that the systems that people have put in place to triage, so we're constantly triaging, aren't we, and then re-triaging and then triaging again, so people haven't been seen and we've had to look at the same patients lots of times and say when they must be seen in order of other people. Those systems have all been made up on the fly, haven't they, in reality? So there's lots of cracks in those systems. So if people are really, really expecting to be seen at a certain time and they've just heard nothing, I would definitely suggest people contact the departments, because we've definitely had patients fall through the crack. Fortunately, we haven't had any major issues with it, but whatever system, I mean, we very hurriedly put together an Excel spreadsheet and sort of made it up, and I'm sure lots of people have done it in similar ways. It's certainly not perfect. Yeah. But as you say, we've just had to rapidly see the urgent ones really urgently, and try and guesstimate the order of priority for everybody else. So that's where it's gone tricky. I suppose the question is actually when will the schedule be back on track?
That depends on when they sort out COVID, doesn't it? And we don't know when that's going to happen.
It's going to be
always going to limit our ability.
Yeah, it's going to be years in reality before, if someone says you're going to come back in 3 months, you can be confident it'll be about 3 months. In reality, I think it's going to be a while before that happens. Yeah, totally. I agree.
Yeah, I'm having to tell patients, I'm happy that your condition's stable, but if there's anything really concerning, do let us know. Or if the appointment is really unexpectedly delayed, do check with us.
Yeah. We've had this.
Your fail safe.
Yeah, totally. But unfortunately, the reality of the way it is that if we say I need to see this patient in 2 weeks and they haven't come back in 6 months, there are sometimes ways which they've just fallen through the cracks, and so we have no way of knowing that. So yeah, but I would definitely advise people if something's happened appointment schedule wise, which just seems absolutely ridiculous, inquire. Don't be bolshy, because obviously there's a million patients to see, but it's definitely worth inquiring.
Yeah.
Yeah.
Okay, and the next question for you, Jay, is probably on that theme of where we can't get people in face to face. How can I make the most of the telephone appointments? So you imagine someone who's been postponed, but now we've decided to do a telephone appointment with them instead. How can they make the most of it? So I guess, what do they prepare in advance? What should they have ready?
Yeah, that's a really good question. I think that's the answer, isn't it? In reality, it's much more tricky on a quick phone call when you're flustered and you're not in a room seeing somebody and talking to them. It's much easier to forget the things you wanted to ask. So definitely write things down, have a little question list or concern list or whatever. And you know what your doctor's going to ask you most of the time, because most people would have seen them quite a few times if they're doing a video consultation. So you can have the answers to those questions, such as, have you noticed a new problem? Is the nystagmus roughly the same as it was? Is there a different in-head posture position? Those sorts of things you can sort of predict people are going to ask. So I guess have some answers ready. But most importantly, if you have queries and questions you want to get from your doctors or your orthoptists, write them down, because it's so frustrating leaving an appointment thinking, I should have asked this. And I'm sure we've all had that experience. What do you think?
Yeah, no, I definitely agree with that. Definitely, if I'm going to call you, I'm going to ask you, is your head posture changing when you're watching the television, or you're trying to read text, or are you struggling with your day-to-day activities? Has your glasses been updated?
Yeah.
Are you managing contact lenses okay?
Absolutely.
Is schooling as it could happen during COVID going okay when it's a child in particular? Are there any struggles, or do they need any extra assistance? These are all the things that I would ask for a telephone consultation.
Yeah, I totally agree. I think that's probably the best way of trying to make the most of them. Good. Okay. So next question. What can I do while I'm waiting to see someone? That's quite a broad question.
It is quite a broad question, but I guess it's like, what can you do to help optimize the vision in your child or in yourself while you're waiting for formal treatment? And I guess if you notice a head posture, let them use the head posture. Talk to Nystagmus Network about visual aids that can help. Get your glasses updated. The simplest thing, having a good set of glasses or well-fitting contact lens, can make all the difference.
Yeah.
And again, just keeping a watch on what's actually making things worse, so that you can avoid those, or at least optimize things so you're not ending up in that situation where the nystagmus is worse. And obviously, if it's getting much more worse than it should do, because we don't expect the simple or congenital nystagmus to be getting worse. That is a worrying sign. So that's one where you shouldn't wait. You should let us know, because that's the one we'd want to see more urgently, where it's actually worse than expected, or there's oscillopsia, or the sensation that things are moving around.
Yeah. The only other thing I would say is, for those, as we said a minute ago, for those symptoms which are intermittent, if they're not there all the time, get some videos, get some photos, be prepared so that you can show someone when you do get to see them. I think that's important. And also pull out all the stuff. If you're, again, it depends which patient you are. If you've been in clinic for years, what can you do while you're waiting? You can be trying to sort of make sure that the other stuff that the eye clinic doesn't directly do is all in place. So thinking about, where am I up to with the CVI support? Where am I up to with registration? Where am I up to with glasses checking? Can I actually just go to an optician while I'm waiting because the eye unit's postponed me for so long? That sort of stuff. So it's thinking about what else other people could do while you're waiting to see the clinicians in the eye unit, I suppose. Okay. Yeah, I totally agree.
Right. And the next question, I guess, when they finally do get in for an appointment, so that's what this question is, what might be different about those appointments at the moment?
Yeah, that's a good question. I think that's there's quite a broad set of answers to that, isn't there? The way things are working in hospitals at the moment is that we are arguably a bit behind what's happening outside of hospitals. So there's lots of mask wearing still, lots and lots and lots of COVID rules, spacing, all that sort of stuff, reduced numbers. So actually the environment that you go into is a bit more COVID-y than it is out if you're walking down the high street. So that's one thing. The second thing is what that actually means is that things are a lot more clunky. So you might have to sit in an area and then someone will call you and you'll go to a different area rather than just sitting outside a room and waiting for someone to call you in. It's a bit odd. The other thing is that some kit is much trickier to do with COVID protection. So little tiny rooms with an eye tracker or with an OCT machine might just be completely vetoed. The hospital might say you cannot use that bit of kit. So you might find you're not having the same sort of investigations that you normally have. What else might you find that's different? I suppose people might be doing less because we're trying to do the bare minimum of what we have to do in a hospital and trying to involve other people, a bit like I was saying a minute ago with opticians and things, trying to get opticians to do the refracting rather than having everything in one-stop shop. The other thing might be that you might be limited in the number of people who can come in. So normally we're more than happy to have 2 parents and 5 siblings knocking around in one little cubicle. But at the moment, we're restricted usually to 1 parent. And again, it depends where you are. But often another parent will have to stand outside the front door unless they have special dispensation to come in. It's things like that. It's clunkiness that is different, I think. But I would reassure people that certainly on the whole, the important stuff that people really need is still being done, which is good. It's the nice bits and the bits that make it easier which have suffered, I think. What do you think?
Yeah, no, I agree. Things which we automatically took for granted before, we're just having to use more clinical judgment. And obviously someone definitely needs that OCT or definitely needs that MRI scan. They're going to get it.
Yeah.
It's just that we have to pause and think in the context of COVID restrictions, do we really need this actually? Can we manage this nystagmus without putting them on an eye tracker and sending them to electrodiagnostics and doing an OCT scan the same day? It might be that we just do clinical examination and the electrodiagnostics, and then we can actually proceed to onward management.
Yeah, no, I agree. I think that's it, isn't it?
Yeah.
Good. Okay, so next question then is, what might be different about my appointments from now on?
Which is exactly the same as the question that you just had.
Yeah, it kind of is, isn't it?
Well, I guess in the future, I guess some of the things that we've brought in, like virtual and telephone consultations, we might still be using those. So I find those quite useful for those intermittent checks on older teenagers and adults where I've started a contact lens or I've started a gabapentin or memantine treatment in adults, and I can actually just do a telephone consultation at 3 months as opposed to bringing them in face to face to see how they're getting on, because they know their nystagmus well. They know if it's making a difference or not. They know the side effects. So I might actually keep that going because it actually works well for especially ones that are coming from out of region and have a long way to go.
Yeah, absolutely. I think that's true across the board, isn't it? It's a bit like any time of disaster. You have to do things in emergencies, and then you realise actually some of those things might be quite good in normal times as well.
Yeah.
I totally agree. I think the video appointment thing is one thing. The other thing we certainly realised is that if you have a patient where you're going to book them in for a year's time, if you quickly sort of have a look at that patient again virtually a couple of weeks before their appointment, quite often things have changed significantly, whereby seeing them in clinic is not the next best thing to do. There's something else to do. So actually reviewing people who are on a long time schedule before actually seeing them in clinic actually pays dividends, doesn't it? So yeah, I totally agree. I think there'll be some things that we've had to do which we think, oh, actually that works quite well. And a lot of that again is about the shared care as well, not doing everything in the hospital. Yeah,
I found that useful for people out of region and on the islands during COVID.
Yeah.
Some of our colleagues would actually do set assessments, send them through, and then we contact the patient and do a telephone consultation with all of that done locally.
Yeah.
And work with the local teams.
Yeah.
And that has well. So some of that we might keep going, only where it's actually basically been much better for the patient.
Yeah, no, absolutely. It's just slightly different models of doing similar stuff, really, I suppose. Okay.
Okay, and right. So for you, Jay, this is an interesting one. My child had nystagmus during COVID. So we been looked after differently to normal? So I guess that's like with everyone that had new conditions during COVID, and COVID took priority.
Yeah, so really, that's a good question, isn't it? I think the honest answer is yes. I think for most people, they will have been dealt with slightly differently, not necessarily less well, but definitely. And the reason for that is that the order of tests that we do are generally based on their availability.
Mm-hmm.
So if we can do, for example, for a new baby with nystagmus, if we can do some electrodiagnostics, so stickers on the head and an OCT scan and etc., we can almost always avoid doing an MRI scan.
Yeah.
But if those things are not available and you can't exclude the things you really want to exclude, and an MRI is available to book quicker, then you might have ended up having an MRI scan. Whereas in normal times, you could probably get away without doing it. Again, it's not necessarily worse. And to be honest, around the country, things vary. We're trying to wrap this up at the moment, aren't we? But things vary a little bit anyway, even in normal times. But I think, in all honesty, these things will have affected how people have been looked at. But I would, again, reassure people that clinicians will almost always just try to exclude the things they're most worried about first, by whatever means. And then it might just take a bit longer to get to diagnosis. And then in terms of management and treatment, again, things will be a bit different because of the availability of stuff, isn't it? And even the VI support, etc., has massive backlogs at the moment.
Yeah.
So yeah, I would say the honest answer is yes, but hopefully still in a safe way. What do you think?
Yeah, no, I think all of our priority was to keep all of our patients safe. By whatever means that took. So it would have looked differently. Of course, it was going to look different to what happened before COVID. Yeah. But still, I think it was keep everyone safe.
Yeah, no, absolutely. Yeah, I agree. Okay, so I think we've got the last question. This is for you then, Helena. So are people with nystagmus reporting different or new problems during COVID, do you think? That's a really good question.
It is a very good question. And I think a lot of what I've had reported is that with more at home working, at home schooling, and screen work, there's been so much more screen time for everyone. There's a lot more difficulties with reading and eye strain. I think it is a lot harder if you have nystagmus to be put in front of a screen all day compared to when you would have normally worked face-to-face or went to school face-to-face. So that's the main thing I've noticed, really. Like everyone else, if they were ill with COVID, your nystagmus deteriorates, but that I think holds true for any time you're ill with nystagmus. You just find that it is harder to control and focus and see, but mainly it's the increased screen work.
Yeah, I totally agree. I haven't noticed a particular totally new thing, but it just seems to have made everything that we already know is tricky with nystagmus much harder, hasn't it? Just because the way the world is. And I think we did that survey study, didn't we? Where we surveyed people with nystagmus about how COVID had affected them and all the rest of it. And that brought the same thing out, really, that just normal bits of daily life that were, you had to think about before, are even more tricky because you're doing them even more. And, I think that's been the main thing. I haven't noticed a specific symptom, I don't think.
No, it's just related to the different form of work that people are having to do with their eyes, basically.
Absolutely, and having to wear a mask and all of that stuff, and
and that steams up your glasses, and
yeah, absolutely, and people can't see your facial expressions. Absolutely.
Yeah,
good. Okay, so I think we've made it through the questions. We probably ought to stop now because I'm sure Sue didn't want us to go on this long. Should we say bye to everyone?
Way past the limit that Sue gave us. I hope everyone enjoyed it.
Yeah, hope you found it useful, guys. Look forward to seeing you on the day.
Yeah. Okay. Bye-bye.